topic, Bill, and I'm going to be demonstrating trach care. So my doctor has ordered trach care for Jacob Morden every 4 hours, so it's due today. We're just going to be looking at the progress note. It says that the cuff pressure was already checked and the trach ties were already checked. So the only thing we're going to be doing is doing the dressing change, doing some suctioning, and changing the inner cannula. Set at 40% humidity. Alright, so I'm just going to set this on the bed here. Alright, so I'm just going to come in my patient's room. First I'm just going to do a check here, safety check. Hi, my name's Robin. I'm just going to be changing the dressing on your trach. He's not in distress, his bed is in lowest position. He has his call bell. I'm just going over here and I'm just going to make sure that my suction is working. So I'm just going to put on some gloves. I just washed my hands. So suction needs to be between 80 and 120. So I'm just going to turn that on. So it is working. And my cold pot is supposed to be set at 40 as per doctor's orders. And this needs to be on. Okay, so my suction's working. Just set this aside. We're going to check his tray here. I'm just going to take a look at your tray. So it's a D7. So that means we're going to need -2 times 2, which is a 10 catheter size for the suction. So I'm just going to check here. I have emergency supplies. I have sterile water. I have an ambu here. I have a dilator. I have all my emergency equipment. I have an extra DIC and an extra tray. So I'm just going to grab my catheter for suctioning. As noted, the dressing is drying So I'm going to so 10 French. Alright, so I have a sterile dressing. So I'm just going to remove these gloves. Put some new ones. I'm just going to get my patient to take 2 or 3 deep breaths. I'm going to increase oxygen. 2 or 3 deep breaths, please. Perfect. So I'm just going to remove this for a few minutes. If you feel any sort of shortness of breath, just let me know. We can reapply it. So I'm going to get a new pair of gloves. This is a sterile drape. I'm actually not going to be using it, so I can get it out here. I'm just going to open it up and use it as like a putty garbage. So I'm just going to open this up. Just going to carefully pull that out. Garbage this. And we're just going to check the suction with this catheter on. And it's still between 80 and 120, so it's safe to suction. So at this point, I'm just going to make sure I'm not close to the tip because we want that to remain still. I'm just going to insert it into the tray. I also need a donut. Now that we're in, I'm going to suction and twist and pull out. Good. You're doing okay? So we're going to just discard this. I'm going to grab another glove right here. Just stick it on here. Discard my gloves. So I'm just going to sit my patient up a little bit more. Alright, so now that that's all set up, alrighty, I'm just going to remove your pillow for this procedure. It's just a bit easier to get at your dressing. How's your breathing? Good, alright, just let me know if you need anything. Need any extra oxygen. So at this point, I'm going to change the DIC. I'm going to put on some gloves. I'm going to find my new inner cannula, and we have it here. So I'm just going to remove it before I set up my tray. Just taking it out, securing it as I'm pulling it out, and it's good. So garbage that. Remove my gloves and get some new ones. Wash my hands in between. So I'm just going to open my DIC package, not to touch it, keep it sterile, no touch technique. Just going to grab the very tip of it. My gloves are too large. I would be using mediums, but there's none left, so we're just going to be extra careful. I might just remove this one at this time. As I'm doing all of this, I actually would have had a mask on before we started, just because there's lots of sputum that I can come in contact with, and I'd like to protect myself. So I would be wearing a mask, and because my gloves are too big, for now I'm just going to go like this, because there's no mediums left. So we're just going to insert this. It's the wiggle, stabilizing the tray. And there we go. So the DIC is changed. So I'm going to discard my gloves, wash my hands again, and we're just going to change the dressing. Are your is your breathing okay, or do you need some oxygen? You need a little bit of oxygen? Sure. So here you go. I'm just going to set up my dressing tray while you take some deep breaths.
My sterile tray there. So that unfortunately I would need a whole new tray. So I would just kind of stop and get another nurse to bring me a tray. But for the sake of this demo, I'm going to bring you. One slight. Make sure I'm only touching within my 1 inch border.
It's going to open.
Another swipe a little bit farther outward.
Adjust my tray here. Put that down. I'm just going to set this here in case I need a new sterile field. I did not touch my sterile tray. Is your breathing doing okay? Okay. So we'll just leave this to the side for now.
Another area, so I make sure that everything underneath the dressing. I also want to make sure that
Those up.
Thank you. And we're just going to.
I forgot to rinse out my tubing with sterile water, so I would do that after. If it's all gucky, I could just get a new one after this procedure is over. So I'm actually just going to grab some normal saline, just so we can clean. So I don't have it with me, I only have sterile water, so I'm just going to call someone in. Can you grab me some normal saline? They did, so we'll say this is the normal saline they brought me, and I'm just going to add it to my tray as not to splash. So I'm just going to put on some gloves and remove the old dressing.
Grab another pair. For the sake of this, I'm just going to continue. So now I'm going to dry in the same manner.
Alright, just going to remove your old dressing. Good. There's not really any exudate on there. It doesn't look too bad, so we won't have to do any excessive cleaning. We're just going to garbage this. And we're going to get new gloves. So I'm going to do the no-touch sterile technique, actually. It's just easier for me. So I'm just going to add cotton tips to my tray.
And then a final pass with a larger
Garbage.
Make sure everything underneath the dressing is dry. And I don't need to dry the tubing. So now I'm going to get my gel mat ready.
So we'll just get these where I can grab them. I'll grab my 1 inch border. We'll put gloves on just in case he coughs, and my mask is on. Alright, so I'm going to dip this in my normal saline. I'm just going to clean around one swipe, garbage, around the top, one swipe, garbage, and we'll do one more. And stabilizing while I'm cleaning. Garbage. So we'll just use a 2x2 just to get a little bit more of the skin that's under the trach clean.
Alright, so now I have my jello net on. I'm then going to put on the IV drainage.
Stabilizing and cleaning a larger area with one swipe. Garbage. We're going to do one more on the top, and then we will dry. How's your breathing doing? Do you need any extra oxygen? No? Good. Alright, and one more swipe. Alright, so now we're just going to dry. That down. Just going to stabilize and dry underneath. It's looking really good. No crusties.
Okay, so I can get rid of these now.
I think this should be the last dry. Stabilize. I'm not turning my back from my tray. And that's dry. Okay. So at this point, I'm just going to grab my drain sponge that I didn't open up already because I don't want to leave it out for longer than it needs to be. So we're just going to fold this back. I'm going to remove the drain sponge. And then I want to make my dressing fully occlusive. Okay, so we're just going to insert this under your tray.
Just touching on edges here. Starting that by pressing overlap.
Just got to wiggle it around the top. So at this point, I'm just going to reach up and pull, just to make sure I haven't touched the part of the drain gauze that's touching the tray. I'm going to put these down and just use my fingers around the edges to kind of get it in place.
That's all finished. I'm going to want to confirm that my patient's doing okay. Their call bell is reached. 6 minutes. Put their
Okay. These are still sterile, my tips, so I'll just get closer in and just kind of move it where it needs to be. And that's about it. Looks good. How are you doing, Jacob? Good? Alright. So I'm just going to remove my gloves and wash my hands and dispose of my tray. So I'm just going to give you some more oxygen again.
Yeah, I did see him. Like, it was really hard to
Go, I'll give you your pillow back. Just because, like, I'm going to document how that dressing change went. I'm going to note that there wasn't really an exudate. The stoma site looks really good. I will clean this tubing with some sterile water since I missed that earlier, or I'll just get a new set. That would even be better. I'm going to lower my patient's bed and get them settled. Making sure I still have my emergency equipment by the bedside. We'll bring in a new thing of sterile water.
I like it right
My
before
ambi
it
bag is
takes
there.
1 minute.
My cold pot is still set at the 40. Oxygen's on. I can shut this off. Alright, Jacob. Just gonna go document that. Do you need anything? No? Okay, and I'll give you your call bell. And I'll check on you. If you need anything, let us know. Okay? Done.